Hello, welcome to Chapter 7. Today we are going to talk about blood, the lymphatic, and the immune system. These all three kind of relate to each other, relate together, so that's why they're put into one chapter. So we're going to look at medical terms, their roots, combining forms, suffixes, prefixes. We're going to look at spelling. We're going to be able to talk about different abbreviations that are related to blood, the different structures of these different types of blood cells that we have, different disorders of the blood. We're gonna go into our lymphatic system, how our lymphatic system works. So let's get started here. Blood is the only liquid connective tissue we have in the body. A person has an average of about 10 pints of blood. So on the bottom, 45% of a sample of blood, somebody is just given a sample of blood, they put it through a centrifuge, so they spin it really fast to separate it. They separate out the blood. That bottom portion is going to be those red blood cells, majority of them. White blood cells and platelets are also going to be found in that area. Plasma is the remaining material that makes up blood. Kind of a yellowish color. It's about 91% water. So these elements are shown here. We can see these formed elements in here. These formed elements are those red blood cells, those white blood cells, and those platelets. They come from this both red and white area. When we first draw blood out of somebody, this is what we see. The whole thing looks red, but once we put it through a centrifuge where we can spin it, this is where we get this separation of formed elements, those red blood cells, white blood cells, platelets, and then the rest of it is that plasma, water, proteins, and just other solutes that we're going to find in there. Your blood makes up about 8% of your total body weight. Again, our skin is going to make up a big portion of that, our bones, our muscles, and then as we go through the rest of these chapters, we're going to talk about the different organ systems. That's all what's left that makes up our body. So, red blood cells here, they're about 45% of those formed elements. And we're going to find about 99% of the red blood cells in that section where the formed elements are. Red blood cells, their main job is to transport oxygen. They're transporting oxygen to our tissues. This carrying of this oxygen to our tissues allows our cells to perform their daily metabolic activities. We use oxygen to make energy. WBCs, these are our white blood cells. Our white blood cells, they're active against different infections, against allergy responses. They're the ones that are acting up. They work with our immune system. And then platelets, these are responsible for clotting of our blood? Plasma. One more here for us. Plasma is a clear yellow liquid, contains different proteins: albumin, globulin, fibrinogen. Serum is very similar to plasma, except it does not contain any clotting proteins. No. Plasma contains all proteins found within our blood. So hematocrit. We can also write hematocrit, HCT. Hematocrit is the percentage of blood that is composed of red blood cells. Plasma, as I mentioned, is that clear yellowish kind of liquid that has the different proteins: albumin, globulin, and fibrinogen. Serum is similar to plasma, but it does not include those clotting proteins. So let's define some of these words here for us. Col, like colloid, means glue. Emma is like anemia. Anemia is a blood condition. Nutrient, like nutrient, means nourishment. The combining form, hemato, means blood, like hematology. Vita, like vitamin, means life. So let's look at the functions of our blood. It's going to maintain your body's homeostasis. Our blood gets rid of waste products, transports oxygen around. It transports different hormones around. We'll get to that in a later chapter in the endocrine system. It's doing a lot of what I just listed here. Transports nutrients, vitamins, and minerals. So your blood picks up these nutrients, vitamins, and minerals from your digestive tract. And then it's going to take them and store them in different cells. We pick up things like glucose, amino acids. Amino acids, if you string different amino acids together, we make proteins. So I said we transport waste products. These waste products are from your cell's normal metabolism. What your cells are making kind of as byproducts of their normal daily activities. They're going to take them to the liver and the kidney for excretion, like urea, bilirubin, lactic acid. These are all being picked up and transported around. And then we also transport hormones, as I mentioned. That endocrine system secretes out their hormones into the bloodstream. And then from there, it's going to get transported around the body to its target cell where it will act on it. Transports gases, oxygen to cells, carbon dioxide from the cells back to the lungs to breathe it out. It's going to protect against foreign substances like microorganisms and toxins. So cells and chemicals in our blood are an important part of your immune system. Those white blood cells, there's different white blood cells and they all do different things. We'll go through those here shortly. They form clots. So your blood works to prevent you from losing too much blood by forming a clot to prevent that excessive loss of blood. So red blood cells, they're also known as erythrocytes. These erythrocytes, they transport oxygen. So they pick up oxygen in the lungs and they're going to take them to different areas around the body, to all of our different cells. Oxygen combines with hemoglobin. Hemoglobin is a protein found within red blood cells that oxygen attaches to. They're also going to transport carbon dioxide. They don't transport a lot of carbon dioxide. They only transport some carbon dioxide, but they're taking this carbon dioxide from the tissues back to your lungs so you can exhale it out. Your red blood cells also transport nitric oxide. This is a gas that is produced by the lining of cells and blood vessels that tell the smooth muscle to relax. So what it's doing is telling those blood vessels when they relax is to dilate or get larger so blood can travel a lot easier through those blood vessels. So there's a lot of different types of anemia. Anemia has to do with those red blood cells or erythrocytes specifically. Anemia in general has to do with a reduction in the amount of red blood cells circulating through our system. No matter what the underlying cause for anemia is, it will produce symptoms of fatigue and shortness of breath. Think about those. If your red blood cells transport oxygen to your cells, but there's not enough red blood cells to transport oxygen, that means your brain's not getting enough oxygen. That's what makes you tired. That shortness of breath, you're trying to breathe more to get more oxygen in. So let's look at the different types of anemia. We have iron deficiency anemia, which is telling you exactly what it is. We don't have not enough iron in our blood. Pernicious anemia has to do with low B12. Sickle cell anemia, this is more of a genetic type of disease. What happens to these red blood cells is they cause this sickle or this C or curved kind of shape. It's more commonly found in African Americans and some Mediterranean people, but it has to do with the production of abnormal hemoglobin that causes these cells to kind of sickle. Hemolytic anemia has to do with too many of those red blood cells being destroyed. Heme means those red blood cells. Lytic, slicing, we're breaking apart. So we're breaking apart too many of those red blood cells. aplastic anemia. This has to do with the bone marrow not being able to produce enough new cells. And it has to do with not just red blood cells, but it's going to do with white blood cells and platelets. White blood cells and platelets. So this has to do with several different types. Aplastic anemia does, but all of these different types of anemia are going to cause that fatigue because you're not getting enough oxygen to your cells, your brain. And it's also going to cause that shortness of breath. So let's go through these. Another term for red blood cells would be an erythrocyte, below normal levels of oxygen. Remember, hypo means below or under. So hypoxia means there's not enough oxygen. A paleness of the skin. Paler. And stick together and form clumps. A glutenate. Whoops. Excess production of red blood cells. Polycythemia. Poly means that many, and that cythemia, they're producing way too many red blood cells. So we looked at what hematocrit means. So let's break these down. Hemato is our combining form. And hemo, our other combining form, they both mean blood. So that gives our combining form for all of these words. Let's look at the next part. Remember that hematocrit tells us that percent of blood that is red blood cells. Hematology, this is a medical specialty of the blood and its disorders. So someone who specializes in the blood and all of the different disorders of the blood. A hematologist is that specialist in hematology. So this person specializes in that blood, those blood cells. Hemoglobin is that red pigmented protein that makes up those red blood cells. Hemolysis, I mentioned lysis before, is that destruction of red blood cells. And hemolytic actually pertains to hemolysis. So here we have prefix, root, and that suffix. Our prefix for agglutinate is that ag. Gluten is our root word. Ate is our suffix. That means composed of or pertaining to, for that ate, gluten is stick, ag is to. So agglutinate is the stick together or clumping of those red blood cells. So pertaining to that sticking together. Hemoglobinopathy, combining form. Another combining form, hemo is blood, globin, O is protein, and that suffix, pathy means disease. So hemoglobinopathy is that disease that caused by the presence of abnormal hemoglobin in red blood cells. An example would be that sickle cell anemia that causes those red blood cells to get that curved or sickle kind of shape. Pernicious anemia. So my prefix means through. Niche means lethal. And that suffix us means pertaining to. Now we have an means without. Anemia means blood condition. So pernicious anemia is a chronic anemia due to that lack of B12. Prior to the synthesis of B12, that discovery of B12 in 1972, pernicious anemia was a lethal condition. Not having enough B12 can kill you, in other words. Let's look at abbreviations that deal with those with blood. RBCs, red blood cells. White, WBC is a white blood cell. HCT is that hematocrit. Oxygen, carbon dioxide, and then we have nitric oxide. HB, hemoglobin. PA, pernicious anemia. SOB. In the medical field, shortness of breath. So let's look at the different types of white blood cells. White blood cells are split off into two different categories. We have granulocytes. These granulocytes contain a kind of a granular cytoplasm. So when they're stained on slides, they're going to have this granular appearance. These granules are enzymes and different chemical production. And then we have those agranulocytes. So when they're stained on a slide to view, they do not contain those little granules. So in our granulocytes, we have neutrophils. A neutrophil, it's the most common. They're going to ingest bacteria, fungi, and some viruses. We have eosinophils. Eosinophils, they only make up about 2 to 4% of the white blood cells, so not very many. But these are present during allergic reactions. So those of you who have allergic reactions, your eosinophils are working pretty hard. They're also around in parasitic infections. And then our last type of granulocyte are basophils. Basophils, usually less than 1% of the total amount of white blood cells. These are going to release histamine. Histamine kind of gives that reddish appearance. It increases blood flow, but in the tissues in your skin, it gives that reddish appearance to injured tissue. It gives that reddish appearance to maybe an infection in your skin. That's that histamine that's being released. It's also that redness and an allergic reaction. They also release out heparin. That heparin prevents blood clots. This heparin has been put into a drug that people can take to, again, prevent those blood clots. Now we have those agranulocytes. We have 2 of those. The first one is a monocyte. Monocytes are maybe 3 to 8% of the total amount of red blood cells out there, or white blood cells, sorry. And these are gonna leave the bloodstream where they become macrophages. Macrophages kind of engulf, so they eat bacteria. And they ingest them and break them down. They also kind of engulf dead neutrophils. They're going to engulf dead cells and tissues. So they kind of just ingest things and break them down. And then we have lymphocytes. Lymphocytes are the most highly trained. They make up about 25 to 35% of white blood cells. It's a pretty large amount. They are your adaptive immunity. So they're the ones that can specialize to that specific virus or bacteria that's come into your system, and they can kill that specific virus or bacteria. They are what become your T or B cells. These are those specific immune responses. So let's look at these different words. We're going to look at the differences and for words that all share the same suffix of site. Site, this suffix for site means cell. So a granulocyte is a white blood cell. So it's a cell without granules in that cytoplasm. While those granulocytes contain many small granules. These cells kind of look speckled. It's the best way to look at them. Your textbook has pictures of it. A leukocyte, this is another word. It means white blood cell. So when you see that word leukocyte, it's just another word for white blood cell, kind of like erythrocyte was another word for red blood cell. Lymphocyte is one of those specialized white blood cells. We went through up here, those are those adaptive immunity cells. Monocyte is another specific white blood cell. As your book says here, it's got a single nucleus, but monocytes are the ones that become those macrophages that go out. Once they leave the bloodstream, they are called macrophages. They're not called a macrophage in the bloodstream, only outside of the bloodstream. So let's look at these terms now. They all have that suffix of "phil." And this means attraction. So the root and that combining vowel of baso means it attracts blue color. Eosinophil, our root and combining form is eosino. This is going to mean drawn. That phil means attraction, so we're drawn or attracted to red color. And then our last one, that neutral, that combining form. Neutral means neutral. So we're attracted to a purple color. These are all granulocytes. So these are the colors of the granules that you're going to see inside of these cells. So their word kind of means what their granules are. More abbreviations. IG means immunoglobulin. Diff, this is when we're looking at different blood cells, differential white blood cell count, EVB. Starts with an E. Epstein-Barr virus. This is the virus that causes mononucleosis, or known as the kissing virus, kissing disease. PMNL, polymorphonuclear leukocytes or neutrophils. Let's look at some different disorders of white blood cells. Leukocytosis. Leukocytosis is having an increase in white blood cells. What can cause leukocytosis? An allergic reaction. Typhoid fever, malaria, tuberculosis, whooping cough, or infectious mononucleosis. Leukemia. Leukemia is a cancer of the hemopoietic tissues. So the tissues that make our blood cells. So it causes an excess production of leukocytes. So it's specific to those white blood cells. The leukocytes take over the bone marrow and cause a decrease in red blood cell production. Because we're making too many white blood cells, we're not able to make enough red blood cells. If we have normal production of red or white blood cells and platelets, if we end a decrease in red blood cells, it actually can leave the body vulnerable to more infections. So there's two different kinds of white blood cells or leukemia. That we're going to talk about at least. There's myeloid leukemia. This is uncontrolled production of those granulocytes specifically. Lymphoid leukemia is uncontrolled production of those lymphocytes. So again, we're looking at these specific white blood cells that are being overproduced. Leukopenia. Leukopenia is when we have a significant drop in white blood cells. Leukopenia is associated with different viral infections like measles, mumps, chickenpox, polio, and AIDS. That AIDS virus specifically affects B cells, so lymphocytes, so it's causing a decrease in those white blood cells that allows different viruses and bacteria to grow very well in your system. And pancytopenia. Pancytopenia it can be a result of chemotherapy treatment for cancer. It causes a decrease in erythrocytes, leukocytes, and thrombocytes. So those erythrocytes, those red blood cells, leukocytes, those white blood cells, and thrombocytes, those platelets. We get a decreased number of all three. Hemostasis. Hemostasis is how do we control bleeding or prevent excess bleeding? Well, vascular spasm. So what happens in a vascular spasm is those blood vessels are going to try to close off. They spasm closed, contracting, and holding a contraction to try to prevent more blood from leaving that blood vessel. We're also going to attract more platelets to the area. And by attracting more platelets to the area, it allows this platelet plug to form. Blood coagulation. That is that blood coagulating. Those red blood cells are coming together to help that platelet plug form a clot to block off that hole in that blood vessel to prevent more blood from leaving. So the different disorders of coagulation: hemophilia. Hemophilia is a deficiency in that clotting factor specifically. Hemophilia A is more common in males, and it's a deficiency of clotting factor 8. Different clotting there are several different types of clotting factors. They're numbered out, so certain types of hemophilia only have to do with one specific type of clotting factor. There is von Willebrand disease. This von Willebrand disease is the disease in which a specific protein of that clotting factor is deficient. Again, it is clotting factor 8. Then we have disseminated intravascular coagulation. This occurs when a severe bacterial infection causes the clotting mechanism to be activated throughout the entire body. So small clots will start to form in your vital organs, like your heart, your lungs, your brain. And it's going to compromise the function of those organs. Eventually, that clotting mechanism is going to become overwhelmed, and eventually it's going to cause severe bleeding to occur, kind of as a side effect of this massive amounts of clotting. So a thrombus is a clot that is attached to the inside lining of a blood vessel. So it says here, a thrombus is a clot, while when a thrombus breaks off of that blood vessel and it starts traveling through that circulatory system, now it has become an embolus. An embolus is something that is traveling around the system. Both thrombus and an embolus can block a blood vessel. It can prevent blood flow through that specific vessel. So thrombocytopenia. If you look at breaking down this word, penia means it's a low count of something. So thrombocytopenia means we have a deficiency of platelets. Purpura. This is bleeding into the skin from small arterioles that produce a larger individual lesion than petechiae from capillary bleeds. Petechiae are a bunch of little red spots on the skin. Bruising or a hematoma are leaks from blood vessels from all types of blood vessels. It's not specific to arteries, veins, capillaries, arterioles, venules. It's just any blood vessel that can cause this bruising or hematoma. While this purpura has to do with arterioles specifically. So coagulant is a substance that causes clotting, while an anticoagulant prevents clotting. So that difference is that anti is going to prevent that clotting, that coagulant. That thrombosis is specifically that clot formation. Embolus, as we mentioned, is that detached piece of that thrombus. A thrombocyte is another name for platelet. Hemostasis is the control or stopping of bleeding. Hemotomia is that collection of blood that has escaped from that vessel into that surrounding tissue. So on the surface of our red blood cells, we have what is called an antigen. An antigen is a cell surface marker that is specific to us. There's an A antigen and a B antigen. So somebody who has type A blood is going to have an A antigen found on their red blood cells. Somebody who has type B blood is going to have that B antigen on their blood cells. Somebody who has type AB has both A and B antigens found on those blood cells. Type O doesn't have any antigens. There's no type A, there's no B, there's nothing on them, which makes type O a universal donor, because somebody who has type A antigens will have anti-B antibodies. Antibodies are proteins that'll go out and attack cells that fit in its little receptor on that antibody. As long as that receptor fits, that cell's going to attack, or that antibody is going to attack that cell. Type O, since there are no antigens, there's no cell surface marker on it, it's not going to respond to those anti-A or anti-B antibodies that are found in people's blood who have type A, type A, type B, or type AB blood. So let's look at some of these abbreviations. ABO, that's that blood group system. That type A blood, type B blood, or that type AB blood. HDN is that hemolytic disease of the newborn. RH stands for rhesus. I did not spell that right. Let's fix that spelling. There we go. So somebody who has Rh positive means they have, this is a different type of cell marker found on those blood cells. So if they have Rh positive, means they have that Rh marker on their blood. Rh negative means they do not have that marker on that red blood cell. And an Rhogram is that rhesus immune globulin. This, if a mother or a pregnant woman has Rh negative blood, so their blood does not have those cell markers for Rh, but they're pregnant with a baby or a fetus that has that Rh marker on their blood. This can happen if mom is Rh negative, dad is Rh positive. They come together and they make an Rh positive baby. Mom's blood will try to attack the newborn's blood or that fetus's blood. So this is given to a mother in this situation to prevent her blood from attacking that fetus's blood and causing more problems. So let's look at, we've got it all written here for us. So let's look at these prefixes. Agglutination, that prefix is that egg, which means two. So process by which cells or other particles adhere to each other to form clumps. Antibody, our prefix anti means against. So protein produced in response to an antigen. That cell surface marker, we produce an antibody that will be against it, will attack it. Autologous, our prefix auto means self in this case, or same. Blood transfusion with the same person as donor and recipient, a self-transfusion. Infusion, our prefix is in, which also means in, which is introduction intravenously of a substance other than blood. And then we have transfusion. That prefix is trans, which means across. So the transfer of blood or a blood component from a donor to a recipient. Now let's look at some different kinds of, these are diagnostic procedures, so different blood tests that can be run. A CBC stands for complete blood count, which means we're getting information on red blood cells, white blood cells, and platelets. We can figure out causes of certain symptoms like weakness, fatigue, bruising. Not enough red blood cells. That can cause most of those symptoms. A blood smear is used. They take some of that blood and they smear it across a slide. They're going to stain that slide with those different colors, the red and blue, for these cells to pick up these different colors so you can determine what type of cells something is, you can determine the size, the shape of those red blood cells, those white blood cells, and those platelets. So treatment depends on, in this case, the type of anemia somebody may have. Iron and B12 replacement is used for any deficiency with the production of hemoglobin. Removal of toxins, drugs, or a radiation source is the treatment for hemolytic or aplastic anemia. Bone marrow transplant is performed when the bone marrow is unable to make proper amounts of different blood cells. Pharmacology, anticoagulants. These are used to prevent that blood from clotting. Aspirin, heparin, warfarin. Aspirin reduces platelet adherence. So it's preventing those platelets from coming together. Heparin prevents prothrombin and fibrin formation. So these are other proteins that participate in that clotting. Warfarin inhibits the synthesis of prothrombin and others to act as an anticoagulant. Recombinant factor 8, developed through recombinant DNA technology, is the main medication used to treat hemophilia A. This is given intravenously through the vein in the arm or the port in the chest. Desmopressin acetate is a synthetic version of this vasopressin that helps to stop bleeding in patients with mild hemophilia. And then there's chemotherapy. So leukemias in both adults and children will be treated with chemotherapy. It's often added with radiation therapy and stem cell treatment or transplant because they're trying to take healthy stem cells and transplant them where we make blood cells to help produce the correct amount of red blood cells, white blood cells, and platelets. So let's move into the lymphatic system. Let's start with figuring out what words we are describing here. So a disease causing microorganism is a pathogen. Substance creating hypersensitivity, that allergic reaction, is known as an allergen. Pertaining to lymph. I'd help if I spelled it right. Lymphatic. And then the vascular lymphatic organ in the upper left quadrant of the abdomen. Spleen. The lymphatic system is what helps to protect us against different pathogens that enter into our system. We have lymphatic capillaries, which are all these little green vessels. These, lymphatic vessels listed here. Those are those lymphatic capillaries and vessels that are found in almost every tissue in the body. Our lymphatic cells, tissues, and organs, they produce those different lymphatic cells. Lymph nodes, which are these little enlargements on these lymphatic vessels, are found all over the body. But these lymph nodes, they filter this lymph and remove it from and remove any kind of foreign matter that may be found within it. And then that lymph is that fluid. It's clear, it's colorless. It's very similar to blood plasma, and it flows through these lymph vessels and these lymph capillaries. Our lymphatic system, it works to absorb excess interstitial fluid found within the tissues and return it to the bloodstream. So we're getting rid of any excess fluids through the lymphatic system. We're going to remove foreign chemicals, cells, and debris from the tissues. And then we also absorb dietary lipids from the small intestine. We cannot absorb fats from our digestive tract. They have to be absorbed into the lymphatic system. Fats are too large to be absorbed through the bloodstream. So like our fat-soluble vitamins, A, D, E, and K, along with any other dietary fats, get absorbed through that lymphatic system and taken into the liver to either be stored or moved on from there. So let's find the suffix to figure out what these words mean. Immune has no suffix. Immune in Latin means protected from disease. Immunity, our suffix, ity is a condition of being protected from disease as well. Immunology with the combining form immuno means the study of protection from disease. That immunologist, that suffix, logist, these are the people who study or specialize in immunology. Immunize, not what I wanted, highlighter, thank you. Eyes is that suffix, which means to protect from disease. Then immunization, our suffix is ization, which is the process, which is the administration of an agent to protect from that disease. So I mentioned those B and those T cells, those lymphocytes. They come into play now with the lymphatic system and our immune system. T lymphocytes or T cells, that T stands for thymus. We have a lymphatic organ in our chest that sits on top of our, like the top part of our heart. This is where these T cells are going to mature. T for thymus. They mature in that thymus. They get made in that bone marrow, go to that thymus and mature. This is 75 to 85% of lymphocytes. B cells. B cells mature. B stands for that bone marrow. So this is where these cells mature. They're going to respond to antigens, which turns them into plasma cells, which produce these specific antibodies to that antigen found on that foreign cell. Those antibodies are also known as immunoglobulins. So let's go through the different types of T cells here. So, killer T cells. They can recognize specific antigens and target cells. Helper T cells begin the defense response against a specific antigen. Memory T cells. This specific cell right here is the cell that remembers every virus, bacteria that you've ever come across. So it remembers. So the next time you come across the exact same virus or bacteria, pathogen, it knows how to kill it quickly before it even shows symptoms. And then we have suppressor T cells. They suppress activation of the immune system. Lymphatic organs. The spleen. The spleen, as we just mentioned, it's in that abdominal cavity. It has 4 functions. It's going to phagocytize or phagocytose bacteria. It's going to help initiate an immune response to antigens, which are foreign markers, or they're cell markers, so antigens that are foreign, and to hemolyze old red blood cells. So that gets rid of red blood cells. They last about 3 months, 120 days or so. And then they get broken down and new red blood cells enter in the circulation. It also stores red blood cells and platelets. Tonsils. Your tonsils are located in your oropharynx, so the back of your mouth, and they help to try to trap any inhaled or ingested pathogens. We also have tonsils in the back of, like, the way back of our nose, nasal cavity. Again, they're helping to trap any pathogens that may have made it into our mouth. Adenoids. These are in that nasal pharynx. Tonsils are in the mouth, adenoids are in the back of the nasal cavity. And then that thymus and that mediastinum, that chest area, and this is where we will mature our different T cells. Okay, let's look at the difference between these words. The spleen, which we just mentioned, is that organ that stores red blood cells. It helps phagocytize bacteria. It breaks down old red blood cells. Splenectomy. This is the surgical removal of the spleen. While splenomegaly or splenomegaly is an enlarged spleen. Bacterium is one bacteria, or it's the singular form of bacteria. Bacteria is that plural form of bacterium. There, that makes sense. Okay. Let's look at some different disorders of the lymphatic system. Lymphoma is a type of cancerous tumor of usually lymph nodes. Usually can be found in the neck, the axilla, or the armpit. We have Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma is a type of cancer that spreads in an orderly manner to adjoining lymph nodes. So this allows the disease to spread depending on, it gets staged depending on how far it is spread. Is it in one lymph node? Is it in several lymph nodes? Is it found all over the body in lymph nodes in different areas? It's going to get staged on how far it is spread. Non-Hodgkin's lymphoma. These are more frequent. And its treatments usually radiation, chemotherapy, and bone marrow transplant. Tonsillitis is that inflammation of the tonsils due to a viral or bacterial infection. There's lymph nodes under the jaw that drain the tonsils. Those usually get enlarged as well. So under your chin, there's lymph nodes that are found in there, and those can get enlarged because of an infection from your tonsils. Splenomegaly, we said, was that enlargement of the spleen. It usually occurs in different infections, hepatitis, mononucleosis, anemias, Gaucher's disease, and lymphomas. A ruptured spleen occurs in a traumatic rib cage and abdominal injuries, like a car accident. If the spleen has been ruptured, they'll usually do a splenectomy. They'll get rid of that spleen. They'll have to take it out. Your liver can usually take over to some extent. Lymphedema is where there's fluid retention resulting from compromised lymphatic system. Because remember, your lymphatic system is going to pick up excess fluid from the tissues. Well, if there's a problem with the lymphatic system, it's not going to do that, and it's going to cause that edema, that collection of fluids. We pronounce spleen, 2 E's, has that hard E versus that splenomegaly and splenectomy has that more soft E because there's only 1 E to it. Pronunciation. So let's look at the suffixes of these words and determine the meaning for each. They all start with lymph. They have that root word lymph here. Every one of these: lymphoma, lymphadenectomy, lymphadenitis, lymphadenopathy, lymphangiogram. So lymphoma, that suffix oma tells it's a tumor. And the lymph tells us what system it is in or where it's at, that lymphatic system. Ectomy means removal. So a lymphadenectomy, we're removing lymph nodes. Lymphadenitis, suffix itis, means that inflammation. So inflammation of those lymph nodes. Pathy means disease. So here we have the disease of the lymph nodes. Lymphangiogram, that suffix. Gram is a recording. So radiographic image of the lymphatic vessels. We have the combining form, lymphangio, which means lymphatic vessels. Lymphedema lymphaden means lymph nodes. So let's go into the immune system. So that antigen, I had mentioned it before, that antigen is that cell surface marker. It is a protein, technically, that triggers that immune response. A mutation is a change in that chemistry of that gene, or a change in that DNA. Antecubital is where blood is drawn. It's that front of that elbow. And there's some veins that run through there where blood is usually drawn from. Resistance, another word here. Resistance is that the ability of an organism to withstand the effects of that antagonistic agent. So your body's ability to fight off and you don't get sick. Okay, there's 3 characteristics that distinguish immunity from the first 2 lines of defense of physical and cellular mechanisms. We have specificity. The immune response is directed against one specific pathogen. The immunity to one pathogen does not grant immunity to others. This is very specific. That memory. So when exposure to that same pathogen occurs again, the immune system can fight it off quickly. So this is what remembers pathogens. And then discrimination is that immune system to identify self from non-self. So immunity is the state of being able to resist a specific infectious disease. So we have cellular immunity and humoral immunity. Cellular involves those lymphocytes. And they're going to directly attack foreign or abnormal cells and destroy them. This is those B cells, those T cells, and those macrophages. Humoral immunity is that production of antibodies, which are going to bind to antigens, inactivating them and preparing them for destruction. Those antibodies are also known as those immunoglobulins. Those immunoglobulins also they're preparing those antigens for destruction. So to administer a preparation to generate active immunity. It's vaccinate or immunize. Those are the same. Those would also be correct. a group of proteins in serum that finish off the work of antibodies. This would be complement. Complement is a group of proteins that destroys bacteria and other cells to weaken the ability of an organism to cause disease. Attenuate. So Hep A. Hepatitis A. Hep B, that hepatitis B. MMR. This is a type of vaccine. Both, so are those, but they're also a type of disease. Measles, mumps, rubella. And this is that vaccine. HIB, HIB is Haemophilus influenza type B. Hypersensitivity is that excessive immune response to an antigen that would normally be tolerated. People who have allergies, this is you. Hypersensitivity, that allergies, so could be ragweed, grass, dust, pollen, trees, dog hair, cat hair, that dander. Autoimmune, your own immune system attacking your own body. And then alloimmune is from transplants, your immune system attacking an organ that was transplanted into the body. Anaphylaxis. This is this very acute, severe allergic reaction. Acute means it happens quick. Asthma is a respiratory disease triggered by allergens. It can also be triggered by stress. It can be triggered by, there's a lot of different things really that can trigger asthma, but allergies are just one of them. So that autoimmune disorder, I've mentioned this a few times, is when that immune system reacts to self antigens with antibody production. We've talked about lupus already. Rheumatoid arthritis, we've mentioned in previous chapters. There's psoriasis, IDDM, MS, multiple sclerosis, immunodeficiency disorders. It can be congenital, acquired, or side effects of medications like corticosteroids, where your immunodeficiency means you don't have those immune cells to help keep you healthy. Congenital means you were born with it, inborn, as it says here. These disorders that are caused by a genetic abnormality, and it's usually sex-linked. So if it's sex-linked, it usually happens to boys more than girls because girls have two X chromosomes. Males have an X and a Y. So if a female gets it, she's usually, or if she gets that gene passed down, that other X chromosome can make up for it. And males, since they only have that one X chromosome, they're going to get it. Immunosuppression. This is a common side effect of corticosteroids, and it's usually used to treatment to prevent transplant rejection and in chemotherapy treatment for cancers. Acquired immunodeficiency. This results in diseases such as AIDS. AIDS is acquired immunodeficiency. HIV is human immunodeficiency virus. This is where that immune system gets severely depressed because these viruses are invading your specific white blood cells and killing them off. Alloimmune. Allo means strange. So it's an immune response that's directed towards a transplant specifically. Autoimmune is an immune response directed at your own body. Auto means self or same. So your own body is attacking itself. Immunodeficiency is that failure of the immune system to react to a pathogen. Well, that immunosuppression is the ability of an agent like medicine to cause the immune system to fail to react to that pathogen, to the body's own antigen, or to a transplant. Which is why some people get immunosuppressive drugs when you get a transplant to prevent your body from attacking it as something foreign. So HIV, mentioned it's human immunodeficiency virus. This is a retrovirus. It can replicate its own RNA in host cells, which allows these host cells to become HIV factories. So viruses will come in, invade our cells, use our cells' materials to make as many copies of itself as it can, and then it breaks free and goes in, attaches to the next cell. Does the same thing. It's attacking those T cells specifically, those T lymphocytes, and it's T cells, it's their job to normally fight those infections. HIV is the virus that does cause AIDS, and its most common causes of transmission are sexual intercourse, vaginal, oral, or anal. Shared needles and drug use, contaminated blood products, or transplacental transmission. So from the mother to her fetus. Dormant means it's inactive. I mentioned the chickenpox virus before. That virus goes dormant. It hides. So it becomes inactive for a time. People who get cold sores, that's a virus that goes dormant, and during stressful events, it can reactivate. Incubation. This is the period of time between when that virus comes into your system and you start to see symptoms of that virus. It can be anywhere from like 2 to 10 days, depending on the virus. Every virus is a little bit different, but it's anywhere from within this time period where you get infected and symptoms start to occur. That is that incubation period. That is that time when that virus or Bacteria has gone into our cells and they're replicating, making copies of themselves. Opportunistic is the ability of an organism or pathogen to cause disease in that host with a lowered resistance. Microbes. Microbes or microorganisms are everywhere. They're in the air, the water, the soil, and all over our body and in our body. We have microbes or bacteria that live in our large intestine that will help us break down people who are lactose intolerant. It'll break down lactose for you. That's what causes gas, is a byproduct, side effect. They also produce vitamin K for us. But back to here. If microorganisms other than the normal invade our body, they become pathogens and infections occur. These different pathogens include bacteria, viruses, fungi, and parasites. So a microbe is short for a microorganism. It is so small that we cannot see it. Endemic is a disease always present in a community. We're hitting the endemic phase more of COVID. It's always present. Then epidemic is this outbreak in a community of a disease or a health-related behavior. When COVID first came out, it was an epidemic because it was a new virus causing massive outbreaks of disease. Nosocomial means it's acquired in the hospital. Those of you who want to work in the hospital, insurance will not pay for those, which is why it's so important to make sure you don't pass what you're treating with one patient on to the next. Diagnostic and therapeutic procedures and pharmacology. So immunodiagnostics utilize antigens and antibody reactions. An antigen is used to detect an antibody, and an antibody is used to detect an antigen. Agglutination tests utilize particles such as latex bead that has been coupled with an antigen or antibody. If the corresponding antigen or antibody is present, clumping or agglutination occurs. Skin tests. This is measuring that level of IgE, that immunoglobulin E antibodies in response to allergens that are injected just under the skin. The reaction is going to show a small red area. Should be. Some people it gets very large. If you've never had skin tests done for allergies before, it itches very badly. You can also do blood tests to detect IgE antibodies in the blood. The problem, if you take allergy medicine, you still need to get off your allergy medicine to do most of these blood tests because those allergy medicines are depressing those immune responses. Immunotherapy. This boosts the body's natural defenses. Some of the different types of immunotherapy is monoclonal antibodies, interferons, interleukins, human normal immunoglobulin, and hyperimmune specific immunoglobulins. So a good example would be allergy shots. trying to desensitize the body to these specific allergens. Immunosuppressant drugs. These prevent or inhibit activity in the immune system. So they prevent that newly transported or transplanted organ from being rejected to help treat autoimmune diseases or control long-term allergic asthma. So we carry about 5 liters of blood at all times. Red blood cells move around the body. They transport oxygen, carbon dioxide. Our red blood cells live about 120 days. After that, the spleen will break them apart. Our white blood cells are most of our immune system. They are working to keep us healthy. Those different types of white blood cells have their own specific roles. So if you have any questions, you can let me know. Otherwise, have a wonderful day. Thank you.